You're sitting in your living room. Your phone buzzes with your latest lab results. You open the portal, heart pounding, and see two very confusing things. First, your MRI report says PI-RADS 3, but right next to it, your PSA blood level is still rising, looking like a little red rocket ship. Your brain instantly goes into overdrive. You start sweating. How can the MRI be neutral, but the blood test is setting off loud alarms? Do you have cancer? Take a deep breath. You are officially in what urologists call the gray zone. I'm Dr. Uro, and today, we're going to solve this medical mystery together. Let's start with the MRI. We use a multi-parametric MRI to scan the prostate. It scores what it sees on a scale from 1 to 5. Scores of 1 or 2 mean you're likely in the clear. 4 or 5 mean high suspicion. But PI-RADS 3? That literally means equivocal. It's a giant maybe. Think of PI-RADS 3 like a blurry security camera photo. The detective can't tell if the guy in the alley is a dangerous criminal or just a friendly neighbor. The image just isn't clear enough to make a definitive call. Naturally, this ambiguity is incredibly stressful when it's your own body we're talking about. But here is the statistic that should help lower your blood pressure right now. A PI-RADS 3 lesion is actually not a reason to panic. According to current urological guidelines, a PI-RADS 3 score only carries about a 15 to 20% chance of being clinically significant prostate cancer. That means there is an 80 to 85% chance that the blurry spot on your MRI is completely harmless, benign tissue. Okay, doc, you might say, if the MRI is probably fine, then why on earth is my PSA still climbing higher every time I take a test? That is the million-dollar question, and it's exactly why so many men get rushed into biopsies they might not actually need. To understand the rising PSA, we have to clear up the biggest myth in men's health. PSA stands for prostate-specific antigen. Notice the name carefully. It is prostate-specific. It is not prostate cancer-specific. Any prostate tissue can make it, healthy or not. So what is PSA actually doing? In a healthy system, these PSA proteins act like microscopic scissors. Their main job is to liquefy semen. Think of your prostate as a busy little factory, and PSA is the specialized product it manufactures and ships out every single day. Normally, these PSA proteins are kept strictly inside the plumbing system. Only a tiny amount accidentally slips into your bloodstream. That is why a normal, healthy blood test shows very low PSA levels. But as men get older, this delicate plumbing system goes through changes. The most common change is benign prostatic hyperplasia, or BPH. This simply means your prostate is bulking up like it's spending all day at the gym. A normal prostate weighs about 20 to 25 grams, but a prostate with BPH can grow to 50, 80, or even over 100 grams. As the prostate gets larger and heavier, all that extra tissue starts producing more and more of those little PSA proteins. Not only is there more PSA being made, but the growing prostate also stretches and squeezes the surrounding tissues and microscopic blood vessels. This stretching creates tiny cracks in the factory walls. Suddenly, a lot more of those PSA proteins start tumbling directly into your bloodstream. So, a rising PSA level might simply mean you have a growing prostate. More healthy tissue equals more PSA. It's simple math. But what if your prostate isn't huge? Another massive culprit for a rising PSA is prostatitis, which is inflammation or infection of the gland. Imagine your prostate catches a cold. It gets red, irritated, and swollen. The immune system rushes in to fight the battle. This inflammatory response is chaotic. It completely disrupts the barriers between the prostate ducts and your blood vessels. During inflammation, massive amounts of PSA can leak into the blood. Your levels can shoot up overnight, looking incredibly scary without any cancer present. So, back to the gray zone. You have a PI-RADS 3 MRI and a rising PSA. Before we jump to a biopsy, we need to do some detective work. Our first and most powerful detective tool to break the tie is a simple, elegant math equation called PSA Density. We combine the two tests you already took. We take your blood test results, and we pair it with the data from your MRI. Remember how we said a bigger prostate naturally makes more PSA? Well, the MRI doesn't just look for blurry spots. It actually measures the exact physical size or volume of your prostate gland in cubic centimeters. It gives us a highly accurate 3D map. To find your density, we simply divide your total PSA number by your prostate volume. It tells us the PSA per gram of tissue. We are basically asking a fairness question. Is your prostate producing an appropriate amount of PSA for its specific size, or is it overproducing? If you have a massive prostate due to BPH, it is perfectly allowed to produce a large amount of PSA. That's proportional and safe. But if you have a very small prostate, and it is still pumping out a massive flood of PSA, that is highly suspicious. Why? Because those extra proteins aren't coming from normal, healthy growth. They might be leaking from densely packed cancer cells hiding inside. Cancer cells disrupt the normal architecture of the gland, destroying the plumbing barriers and dumping PSA directly into your bloodstream much faster. In the medical world, we look for a magic threshold number. That golden number is 0.15. If your PSA density is below 0.15, the chances of finding aggressive cancer in a PI-RADS 3 lesion drop drastically. For many men in the gray zone, a low-density score is the ultimate reassurance. It's the green light to safely skip the biopsy. Instead of painful needles, you and your doctor can simply choose active surveillance, watching the numbers closely over the next few years. But what if your density is right on the borderline? Or what if we need even more proof? That's when we deploy advanced biomarkers. Let's zoom back into your bloodstream. When we look closely at those little PSA proteins, we find they actually travel in two different ways. Some of them are bound. This means they are tightly handcuffed to large, bulky carrier proteins acting like heavy security guards. Others are known as free PSA. They float around completely solo, dancing happily through your bloodstream without any heavy attachments holding them down. Here's the fascinating part. Healthy prostate cells, like our buddy Prosty when he is just enlarged, tend to release a lot of free PSA. But cancer cells behave differently. They produce PSA that gets instantly bound to proteins. So, a high percentage of free PSA is actually great news. If the free PSA test still leaves us in the gray zone, we move to liquid biopsies, like the Fork score or SelectMDx. These advanced tests don't just count proteins. They scan your blood or urine at a microscopic level, searching for specific genetic fingerprints. The scanner is looking for the unique DNA or RNA footprints left behind by those mischievous cancer crabs, even before a tumor fully forms. If these genomic tests come back low risk, the mystery is solved. You can safely avoid a biopsy and just continue with active surveillance. But what if the biomarkers come back high risk? Does that mean you are doomed to a terrifying, random procedure? Absolutely not. Technology has evolved. In the past, doctors had to perform standard systematic biopsies. They were essentially flying blind, taking random samples and hoping to hit the target. Imagine a blindfolded detective throwing darts at a map, hoping to accidentally hit the criminal's hideout. It was inefficient and often missed small details. Today, we use an MRI-Targeted Fusion Biopsy. We take that 3D MRI map we made earlier and fuse it live with an ultrasound. This creates a real-time GPS system for your prostate. The doctor can guide the tool perfectly to that specific PI-RADS 3 spot, ignoring healthy tissue. By combining the MRI map, the density math, and the biomarker clues, we only investigate exactly what needs to be investigated. No more guesswork. But there is one more crucial piece of the puzzle that we haven't talked about yet, and that piece is time. In urology, we closely monitor something called PSA velocity. This isn't just about how high your PSA number is today. It's about how fast that number is climbing over time. If your PSA slowly creeps up by a tiny fraction over several years, that is completely normal. That's just your prostate gradually growing older and a little chubbier, thanks to standard BPH. But if your PSA suddenly shoots up like a rocket, for example, rising by more than 0.75 in a single year, that grabs our attention. However, before you let a sudden spike terrify you, we need to check for false alarms. The prostate is a very sensitive organ. Did you recently ride a bicycle before taking your blood test? Believe it or not, sitting on a hard bike saddle physically squishes the gland. When the prostate gets squeezed like a sponge by a bicycle seat, it temporarily forces extra PSA into your bloodstream. This creates an artificial spike in your numbers that looks terrifying on paper, but usually resolves on its own within a couple of days. Another major false alarm? Recent intimacy. Ejaculation works the prostate muscles very hard, which also releases a surge of PSA into the blood. Even something like temporary urinary retention, holding your pee for way too long, or a minor urinary tract infection can irritate the gland and spike the numbers. This is why, before you ever panic about a sudden PSA rise, we always ask you to follow a strict protocol before your next blood draw. For at least 48 to 72 hours before a PSA test, no bicycle riding, no heavy prostate massage, and no intimacy. Give the gland time to rest. If you rest up, retest, and the number drops back down, congratulations. You just avoided an unnecessary biopsy caused by a bumpy bike ride. By looking at the velocity and eliminating these lifestyle false alarms, we refine that blurry PI-RADS 3 picture into something much, much clearer. So, after we gather all this data, the MRI, your prostate size, the density, the biomarkers, and your lifestyle history, we finally reach the finish line. It's time for what we call shared decision-making. This is where you and your doctor sit down, look at the whole puzzle, and decide together. For a PI-RADS 3 lesion, the road usually splits into two very distinct paths. The first, and most common for low-risk patients, is active surveillance. Active surveillance doesn't mean ignoring the problem. It means you go about your normal, happy life without undergoing an invasive procedure. Instead, you simply check in with your doctor every 6 to 12 months for a blood test or a follow-up MRI to make sure nothing has changed. The second path is the targeted biopsy. This is usually recommended if your density is high, your biomarkers are suspicious, or your PSA is climbing incredibly fast. Even if you do need a biopsy, I want to reassure you, a biopsy is no longer the blind, intimidating procedure it used to be. Because we use the MRI-Targeted Fusion method, the doctor only takes tiny, precise samples directly from the PI-RADS 3 spot. This means fewer samples, less discomfort, and a much lower risk of side effects like infection. It's safer, faster, and highly accurate. In fact, studies show that using MRI and advanced biomarkers before making a decision reduces unnecessary biopsies by up to 30%. That means millions of men are avoiding the anxiety and pain of unnecessary procedures. You now have the power of precision medicine on your side. To sum it all up, a PI-RADS 3 MRI is a maybe. A rising PSA alone does not automatically mean cancer. It often just means an angry or aging prostate. Ask your doctor about your PSA density. Ask about free PSA or genomic biomarkers. Don't be afraid to ask for these tiebreakers. Remember, you are in control of your health journey. Take a deep breath, gather the facts, and step out of the gray zone with confidence. The information in this video is for educational purposes only and does not substitute for professional medical advice. Always consult your doctor before making any health decisions. But wait, if you and your doctor choose active surveillance, does that mean you just sit on the couch for 6 months and do absolutely nothing? Absolutely not. Active surveillance means being proactive. While we watch the numbers, you can build a powerful lifestyle defense shield for your prostate. The biggest enemy of a healthy prostate is chronic inflammation, and the Western diet, packed with processed meats and refined sugars, is like pouring gasoline on that fire. Instead, urologists strongly recommend leaning into a Mediterranean-style diet, which acts as a natural fire extinguisher for your cells. The undisputed superhero of prostate nutrition is lycopene. It's an incredibly powerful antioxidant found primarily in red tomatoes. But here is the scientific trick. Your body struggles to absorb lycopene from raw tomatoes. You need to cook them. Heating tomatoes with a little olive oil, like in a marinara sauce or tomato soup, breaks down the cell walls, making the lycopene highly available for your prostate to absorb. Combine that with daily green tea, which is loaded with EGCG, another elite antioxidant proven to calm prostate tissue and protect cell DNA. Now, what about the supplement aisle? Millions of men spend a fortune on over-the-counter prostate pills, especially saw palmetto. The hard truth from multiple large-scale NIH studies? Saw Palmetto performs no better than a placebo at lowering PSA or shrinking the prostate. Save your money for real food. And if you want a free supplement that actually works, get your heart rate up.
You're doing great.
What is good for the heart is perfectly good for the prostate. Cardiovascular exercise increases blood flow to the pelvic floor. This massive rush of fresh, oxygenated blood acts like a pressure washer, physically helping to clear out stagnant inflammatory cells from the gland. And don't forget pure water. Staying highly hydrated dilutes your urine, preventing acidic irritation as it passes right through the center of the prostate. So, cook your tomatoes, brew your green tea, keep moving, and drink your water. That is how you master the gray zone. But perhaps the most important defense mechanism of all isn't on your dinner plate. It's protecting your mental health. It is incredibly easy to fall into the trap of PSA anxiety, where every minor fluctuation in your blood test ruins your entire week. Remember, PSA naturally bounces up and down by as much as 15% just from day-to-day life. A single, slightly higher test is rarely an emergency. Active surveillance is about the long-term marathon, not a daily sprint. Your job is simply to stick to the schedule. Typically, this means a simple PSA blood test every 6 months and a follow-up MRI every 12 to 18 months. Treat your urologist as your partner. Bring your questions, ask about your PSA density, and discuss your lifestyle changes openly. The PI-RADS 3 gray zone doesn't have to be a scary place. With modern tools, we can solve the puzzle. And give your prostate the care and respect it deserves, without rushing into unnecessary, painful procedures. So that you can get back to doing what matters most, living your life to the absolute fullest.
Hilarious. That was wonderful.
Thank you so much for joining us on this medical journey today. We hope we've brought some clarity to the gray zone. If this video helped lower your anxiety, please hit that like button and subscribe to the channel for more easy-to-understand health guides. And please, share this video with any man in your life who might be stressing over a confusing lab result. Knowledge is power. See you in the next video, and stay healthy. The information in this video is for educational purposes only and does not substitute for professional medical advice. Always consult your doctor before making any health decisions.